All right. It looks like we are on. Hi, everybody. This is Dr. Corolla Okogbaa with Louisiana Center for Eyes. Thank you so much for joining me today as we tackle another eye topic on eye health conversations with Dr. Okogbaa. And so, for those who don't know me, I am the founder of Louisiana Center for Eyes, where we help individuals reach their best vision and help them to maintain a healthy eyesight. And so today I want to talk about dry eyes some more. We've been talking about dry eyes, which is a huge problem in our society today, right? So it's having an impact from young people to older individuals, and so I'm seeing dry eyes, in every single age group. And we've kind of talked about some of the causes of dry eyes and so on. And so the I want to talk today about a question I get a lot as well about dry eyes. So someone will come in and say, Doc, can my medications actually be making my eyes dry? Okay. So we've talked about how dry eyes is a multifactorial issue, meaning that many different things contribute to your eyes being dry, from your environment, previous surgeries, how much you're using your eyes, how much sleep you're getting, just whether or not you're blinking your eyes. So all different type of factors. And so one of the factors that can also contribute to your eyes being dry are medications, right? Have you ever thought about that? That your meds can actually be causing your eyes to be dry or adding to the dryness. And so I'm going to give you, there's a list, a huge list, but I'm going to give you about seven common drug types or medication types that can actually, that's been linked to dry eyes, that can impact the severity of your dryness. Okay. And so when we see you in the office, we're looking at all of these factors. Is it medications? Is it, or is it some other issue? And so what are these meds? So let's start with diuretics. Some people take diuretics, which is, some people will refer to it as their water pill, right? Some diuretics are used for blood pressure, and they can dry your eyes out. The diuretics, because again, you're removing fluid from the body, and that's, the eyes are an organ, right? And so they can also get dry from that. Also, other medications, other blood pressure medications like beta blockers. You wouldn't think that beta blockers cause dry eyes, but they've been linked to causing dryness. And one of the ways is the fact that they lower the blood pressure. They lower the pressure in the arteries, as well as your small capillaries, so that can reduce the production of tears. Yep. So blood pressure medications can contribute to dry eyes. What are some other ones? Well, certain antidepressants, particularly things like amitriptyline, also anti-anxiety medications, or medications for mood disorders or panic disorders like lithium. These type of medications, they can contribute to dry eyes. And remember, like I said again, dry eyes is multi-factor. So there's typically more than one cause of your dry eyes. So it needs to be addressed at different angles to help you maintain healthy eyes. Okay. Some other medications, we said antidepressants, anti-mood medications. Also, antihistamine, right? Antihistamines, the medications we take for allergies, can actually dry your eyes out. And so just remember that. Also, what other medications? If you take chemotherapy medications, chemotherapy drugs can also have an impact on the eyes and cause dryness. And sometimes they can destroy those glands that we have in the eyes, the meibomian glands. And so that can cause further dryness. And then lastly, I like to add is actually certain eye drops that you take for a long period of time, or you're on it chronically. Like, for example, medications that we use for glaucoma. So when folks are on these medications for years, because remember with glaucoma, there's no stopping your treatments, right? So sometimes certain medications, some of these medications, they can cause dry eyes with long term use. Okay, so those are some of the medications. Again, there are others, but those are some of the main ones I wanted to point out. And really, when you see the doctor, it's a matter of it helps us to manage your dry eyes when we know what medications you're on, and we know that the medications have potential to lead to dry eyes, or are part of the cause of your dry eyes, and we can address that together. Okay, so medications can cause your eyes to get dry, as well as other factors. And so, how some of the reasons is that some of these medications can reduce the reflex tearing. It reduces the nerve input to letting the eyes know to make tears, or even reduce the production of the tears that helps to maintain the surface of the eyes. So those are some of the ways that medications can actually cause the eyes to get dry. And again, that's in addition to other things, other factors that can also be contributing to dry eyes. So I hope this information has been helpful to you. And if you know someone who have dry eyes, or if you're experiencing dry eyes yourself, I'd love to work with you. Make an appointment, make an eye appointment, especially if you're in the Baton Rouge, Louisiana area, and we can help you with on your journey to helping you have a healthy eyesight, and control the dry eyes that you may have. And if you know someone who may benefit from this information, please send them this video and share it for me. Thank you so much, and you have a wonderful day. Until next time. Bye.